Live breaking news from your local news channel.
Good Friday afternoon to you. Thanks for joining us for this News Channel special report. I'm Beth Farnsworth. Santa Barbara County is holding its weekly briefing on the COVID-19 pandemic. Let's listen in.
Announces the latest round of report cards next Tuesday. The Board of Supervisors has scheduled a special meeting that day. The Public Health Department is preparing in advance to issue a local health order that allows for the reopening of many businesses immediately. After 14 days in the red tier, all K through 12 schools may open without the state waiver process. The decision to reopen local schools remains at the local level in the hands of elected school board members who must carefully balance many complex logistical issues and protect the health and safety of students, faculty, and staff. Moving to the red tier will be a very important step forward. We should all be justifiably proud of the progress we've made together to reduce the spread of the virus in every community in every part of the county. While it's very important to acknowledge that we are on the verge of a significant milestone, we also cannot become complacent and imagine that the worst of the pandemic is in the rearview mirror. We have to remain vigilant and attentive to all the personal choices we've made together to get us to this moment. Moving into the red tier is not our end goal. If we continue to persist and remain diligent about our own choices as individuals, new opportunities for even more business reopenings could occur if we can also reach the next less restrictive orange tier. The state guidelines require us to stay in the red tier for a minimum of 3 weeks before our status can again change. Over the course of the pandemic, we had a similar moment in late May when we thought we had the virus under control. The reopening of businesses around Memorial Day led to a sharp upward spike in cases across California. At that time, the governor had not yet issued the mandatory statewide mask order. This time, we all know the critical importance and value of masks. It's my hope that we'll be moved through this next phase of business reopening much more successfully than the first time around because we are all wearing masks now. Compliance with mask order is very good throughout our county. We're all getting much more used to our new normal. I'm sure each of you has accumulated a collection of masks, and the newer versions are much more comfortable and better fitting than the first versions. I've noticed people are using masks as fashion accessories, coordinating colors and designs, and personalizing the look of their masks. This is wonderful because it demonstrates we understand masks must be part of our lives for the foreseeable future. Wearing masks in public is a very obvious way to demonstrate you care about your neighbors and want to do your part to protect others. It's a sign of respect and a visible demonstration that you want to protect public health. What isn't so obvious or public are the decisions each of us make individually about gatherings. Living in this isolating Zoom world is difficult and unnatural. As we move into fall, there are many holidays right around the corner, and it's natural to begin thinking about what our celebrations will look like this year. The answer is our holidays will be different. The pandemic will not take a break for the holidays, so we must remain focused. We must be creative and careful and continue to avoid gatherings that could invisibly spread the virus throughout our community. We know the virus can be spread by asymptomatic individuals. Getting friends and family together indoors without masks is the perfect prescription for unintentionally spreading the virus. The public health consequences, the economic pain and disruption that would occur from having to close and recently reopen businesses could be the final straw that would lead to the permanent closure of those businesses. All of that is avoidable if we all just remain patient and steadfast and remain committed to not gathering together for a little while longer. Finally, a flu vaccine is more important than ever. This year, I want to encourage everyone to get a flu vaccine to protect yourself, your family, and your community from the flu virus. A flu vaccine this season can help reduce the burden on our healthcare system, and allow our healthcare system to respond to the COVID-19 pandemic and save medical resources for use and care of COVID-19 patients. Flu shots are covered by most health insurance plans, Medicare Part B, Medi-Cal, and the Vaccines for Children program. The Santa Barbara Public Health Department is offering free drive-up flu clinics at 3 locations this year. The flu shot clinic will be held in Lompoc on October 6th and 7th at Lompoc High School. In Santa Barbara, flu shots will be offered on October 8th and 9th at San Marcos High School, and the Santa Maria location is at Allen Hancock College, and the dates are October 13th and 15th. The more people vaccinated, the more people protected. Do your part, get a flu vaccine as soon as possible. Next, we have Dr. Vonda Reynoso, Director of the county's Department of Public Health.
Thank you, Supervisor Hart. As Supervisor Hart mentioned, if we can maintain a downward trend in new cases per day and testing positivity, most likely we will be officially assigned to the red tier next Tuesday, September 29th. When we are in the red tier, we can look forward to schools reopening to in-person learning 14 days after we are officially in the red tier, but local school officials will decide when that will occur. Retail open indoors increase from 25% to 50%. Personal care services can open indoors with modification. Places of worship can open indoors with modification at 25% or 100, whichever is fewer. Fitness centers can open indoors with modification at max 10% capacity. Restaurants can open indoors with modification at 25% or 100, whichever is fewer. When we get to the red tier, we will need to be even more diligent in wearing our masks, maintaining our distance, and limiting our gatherings with others not in our household. Everyone must continue to do this in order to decrease the transmission of disease in our community so that we can continue to move to less restrictive tiers. As a community, we have been achieving these goals, and we must continue to achieve these goals. Everyone can make a difference, and everyone must strive to make that difference. And with fall and winter holidays around the corner, we are concerned that new cases will be rising due to gatherings and celebrations. We are working on guidance for Halloween so that our community can celebrate in a safer manner. What I can say for now is that Halloween cannot be celebrated in the same manner as previous years because we are in the middle of a pandemic with widespread disease transmission in our community. We will be issuing guidance next week containing safer alternatives for Halloween activities. Testing remains central to our strategy to contain the spread of COVID-19. Testing is a critical tool that allows us to identify where in our community the virus is spreading. Through testing, we can then find positive cases, isolate them, and do contact tracing to stop the virus from spreading further. Again, thank you to all those who heard and responded to the call for action to be tested for the coronavirus. We have seen an increase in our testing at local testing sites. Our Goleta testing site continues to be a popular one, so we urge community members who are wanting to be tested to book appointments in our Buellton and Santa Maria testing sites. While testing is available at all of our sites, you may need to wait several days for an appointment. If you are not able to get an appointment immediately, we want to remind everyone that the state-run sites are only one of the many locations where you can be tested. Please visit covid19.ca.gov and navigate to Where Can I Get Tested? At the bottom of the page. There you will find a state-hosted map of testing locations in our county. Please call the facility to confirm that they are doing testing before arriving. Most importantly, if you are ill or have symptoms of COVID-19, we encourage you to reach out to your healthcare provider for guidance and access to testing. In closing, I would like to say that we know this has been a long and arduous process for so many in our community. Schools have remained closed, and businesses have had to close, then reopen, only to close again. This has been a difficult moment for every person as we continue to carry the weight of this pandemic. Our goal is to ensure that our community gets to a safe and healthy place to resume activities as part of our new way of living. We are following the best advice of state public health officials and are consistently evaluating the guidance and the situation in our county in order to make the best decision for our community going forward. Our ability to sustain our decreasing case rates by limiting gatherings, practicing social distancing, and wearing our face coverings is helping our whole community. Thank you.
Thank you, Dr. Del Reynoso. Dr. Henning Ansberg, the county's public health officer, is here to share an update on the high number of COVID-19 cases that are appearing among young adults and the status of the elementary school waiver approval process.
Thank you, Supervisor Hart. Good afternoon, everyone. I want to share a new development. Although we are making great progress in the county over the past 3 months, the percentage of young adults infected by COVID has increased steadily. In August, the test positivity rate for 20-year-olds was the highest ever at 23%, followed by people in their 30s with a 17%. Of all positive tests performed in California in August, 40% were in people in their 20s and 30s. Obviously, younger and healthier people generally have better odds at hopefully experiencing a less severe disease process. However, this is not guaranteed. Even if you do not have diabetes, hypertension, or obesity as underlying and complicating health conditions, a recent study showed that young adults between the ages of 18 to 34 experience substantial rates of adverse outcomes when hospitalized. 21% of all hospitalized had to require intensive care units. 10% needed to be on a ventilator, and 2.7% died in this young age group. Obviously, these are very sad statistics. However, even if a young adult does not get severely ill themselves, they are still driving the transmission in the community. Asymptomatic or mildly symptomatic spreaders of the virus are putting their friends, families, and everyone else around them at risk of contracting the virus. A recent observation in the southeast of the United States showed that an increase in the test positivity rate in people in their 20s was later followed by an increase in test positivity rate in people in their 40s and 50s about 9 days later, only to be followed by a higher positivity rate of people above the age of 60 after an additional 6 days. This hints to the fact that young people have become drivers of community transmission of the coronavirus. Locally, we are working closely with UCSB and Santa Barbara City College, as well as Isla Vista community groups, to increase testing availability and to raise awareness about the dangers of mixing and mingling at this time. If we want to get the COVID outbreak under control, we need more cooperation from the young generation. I'm appealing to our young people. Please influence your peers to take this seriously. Please stay safe. Protect yourselves and your friends, as well as the whole community, by wearing masks and maintaining social distance. Recent studies have confirmed that respiratory droplets from our outbreath can get aerosolized into smaller particles that can travel even further than 6 feet and linger in the air while still remaining contagious. Wearing a face mask is the most powerful tool we have in conjunction with social distancing to protect ourselves and the people around us from COVID. Regarding school waivers, we have received a total of 30 elementary school waiver applications. So far, 21 have been going through the complete approval process. 2 have been sent to CDPH for final approval. We are working with 4 applicants to complete their applications, and 3 new applications are being reviewed today. To date, there has not been a single waiver been denied in our county. Once our county progresses to the red tier, we will no longer require schools to apply for waivers because all K-12 schools will be allowed to open, potentially as soon as October 13th. The Public Health Department continues to support our schools and school districts in being very deliberate and intentional with their safety plans and protocols. We cooperate closely to ensure that schools are equipped to follow the safest protocols possible to keep students, teachers, and other employees safe. Thank you.
Thank you, Dr. Anzorg. We'll now go to questions from the room. Mr. Devine?
First question for me, how long have we now been in the purple tier? How many weeks?
We've been in the purple tier for 3 weeks.
Perfect, thank you. And then just going back to what Dr. Anzorg was saying about the new development of young adults, the 23% test positivity rate, was that in August? Okay. And then any specific locations, was that mainly in Isla Vista? Or
California.
throughout California? Okay. And then another question I have is with that 7-day delay in the tier evaluation period, you guys are saying it looks pretty promising, but I guess what I'm wondering is, how do you guys not know whether or not we're already online to qualify if we already know what the numbers are, given it's a 7-day lag?
So if you, I invite you to visit our website, and with the 7-day average over 7-day lag, so on the tier assignment is on a Sunday through a Saturday. So with a 7-day lag, we still have today and tomorrow, which is Saturday, numbers that have not been calculated. And so, and it's hard. We anticipate that it will continue on a downward slope, but there is really, anything can happen essentially.
But what gets evaluated on Tuesdays from last week, not
Correct.
from this week?
Correct.
So I guess what I'm wondering, those numbers from last week, how promising do they look?
They look really promising. They look really promising, but again, we're missing data. The data from today and the data from Saturday is still outstanding. And those two numbers will be taken into, the state will take those two dates into consideration in doing the calculation. And the state doesn't do the calculation until Monday morning.
Makes sense. I guess my other question is, if we weren't to qualify for the red tier, how would you guys plan on keeping morale high? Because obviously a lot of businesses are preparing for Tuesday to finally be the day to reopen.
It's a good question. We're looking at the glass half full and hoping that the trend that's been going on for some time continues, and want businesses to be prepared, planning in advance, anticipating good news and ready to react to that if that occurs on Tuesday. But it's not official until it is announced on Tuesday.
Lastly, for me, what's the biggest lesson we can learn from widely reopening in late May to potentially reopening again next week?
I think the key is masks. In May and Memorial Day, they were not being used to the extent that they are today. The governor had not issued his statewide mask order, and the result of that has been a significant improvement in the transmission of the virus around the whole state of California, and we have benefited from that because our residents are recognizing how important wearing masks are and are really stepping up to that responsibility.
Thank you.
Thank you, Mr. Devine. Next, we'll go to questions on the phone.
Yes, first up, we have Tom Bolton with Newshawk.
Thank you very much. My question's somewhat of a follow-on to what Blake was asking, and I'm wondering if you could explain the difference between the episode date cases and the numbers of cases that you report on a daily basis. The former, of course, is what's being used to decide what tier we're in, and those numbers tend to be very different than the numbers you report on a daily basis.
Sure. So,
Yes, that's for Dr. Del Reynoso.
yes. So in alignment with the state, we are reporting new cases on episode date with a 7-day lag. The episode date is defined as the earliest date of illness, such as the onset date of symptoms or specimen collection date. And this method takes into consideration the lag in reporting systems, and the data is used to calculate the case rates for the tier assignment, as you mentioned. Whereas the new cases for today that our community is accustomed to us reporting out prior to the episode date methodology, we are continuing to report this to give the community a sense of cases. The number of cases that we report each day is the total reported numbers via the state's CalReady reporting system. These numbers reflect the new cases received by the health department and do not count for the specimen collection date, nor does it account for the lags in processing or reporting. So that's the main two difference.
So really the difference is that in one case, it's just a sort of a raw number. In the case of the episode dates, somebody is analyzing the details and saying, well, we reported this case on Tuesday, but it was actually a case from last Thursday or what have you.
That is
Is that kind of a correct assumption?
That is correct.
And I'm wondering also what is the figure you all are using for the Santa Barbara County population?
It's from the Department of Finance, and oh gosh, it's 453,000 and some odd numbers. I'm more than happy to email that to you, Tom, afterwards.
That'd be great if you could do that. I think those are my questions. Thank you.
Thank you, Tom. And next up, we have Laura Place with Santa Maria Times.
Hello. I was wondering if you could speak a little more to the increase in testing that you saw over the past week. Did you see, can you quantify that a little bit, or did you mostly just see it in Goleta? Were there increases in Santa Maria as well?
We saw it in Goleta. So our testing sites in South County, first at Earl Warren and now at Goleta, continue to be at full capacity, meaning that there are quite a few community members taking that opportunity for the free testing, whereas the site in Buellton and the site in Santa Maria are more sporadic in being full. And we know that people are testing more because our adjustment rate from the state reflects us meeting the state median as well.
Okay. And prior to, the announcement encouraging more people to get tested, how far off from that state standard testing rate were we?
We are insignificantly, the difference is very insignificant. The adjustment is 1.02, I believe, so very, very negligible.
Okay.
And with the previous week, in the previous rating period, we actually exceeded the state median. And the state median will be used for the next 3 weeks.
Okay.
Thank you, Laura. Next up, we're going to Fabiola Navarrete with Tu Tiempo Digital.
Yes, hello, good afternoon. This is for Dr. Vander Reynoso. I just want you to repeat, please, the list of the businesses that will be open when we pass from this tier to the red one.
Yes.
The kind of businesses that will be open, please?
Yes.
Sorry.
So if we are officially moved to the red tier, retail can increase indoor operations to 50%.
Okay.
Personal care services can open indoors with modification. Museums, zoos, and aquariums can open indoors with modification, 25% capacity. Places of worship can open indoors with modification at max 25% capacity or 100 people, whichever is fewer. Movie theaters can open indoors with modification, max 25% capacity or 100 people, whichever is fewer. Gyms and fitness centers can open indoors with modification at max 10% capacity. Restaurants can open indoors with modification at max 25% capacity or 100 people, whichever is fewer. And those are the key ones.
Okay, thank you. Thank you so much.
You're welcome.
Thank you, Fabiola. We have no further questions.
Thank you for those questions. The Board of Supervisors has scheduled a special meeting this coming Tuesday, September 29th at 9 a.m. to hear a COVID-19 update from the Public Health Department. The county's newest weekly state report card status will be announced at that time. As we said previously, we're very hopeful this report will have Santa Barbara County in the less restrictive red tier at that time. Our next press conference will be held a week from today on Friday, October 2nd at 4:30 p.m. If you have any questions, please call the 211 information line. Local information on COVID-19 and access to support and services is available 24 hours a day, 7 days a week in multiple languages. Please continue to practice these 3 simple personal steps every day. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2,
Santa Barbara County Public Health updating the community on the COVID situation, and Supervisor Greg Hart just pointing to one of the big takeaways. All eyes on next Tuesday's supervisorial meeting. Starts at 9 a.m. as Santa Barbara County is looking ahead to see if we can move into the next less restrictive red tier. Also, we'll learn some guidance about Halloween coming up next week as well. And also concerns tonight about the high number of young adults contracting COVID, those people between the ages of 20 and 30. We'll break down the numbers for you coming up next.
Stay with your news channel for breaking news updates on air and on all your devices.